I would like to acknowledge our in-person audience. Thank you so much for being here, as well as those joining us online. My name is Sarah Szanton. I'm the Dean of the Johns Hopkins School of Nursing at the Johns Hopkins. I just said that. And today I'm joined by our esteemed guest, Dr. Mandy Cohen, Director of the Center for Disease Control and Prevention. Welcome. We're
Thanks
so happy
for
to
having
have
me.
you.
Thank you. Great to be here. Hi, everybody.
So I don't know who else has been keeping track, but Director Cohen has been the CDC director for almost a year.
Within a few days. Yes, almost my anniversary. Yep.
Congratulations.
Thank you.
Will you tell us about your first year and how you're moving the agency forward after the pandemic and your goals and mission for the agency?
Sure. Well, first, great to be back at Hopkins in this beautiful building in DC. I was here for one of the very first events here, so it's great to be back. And it's been a busy year. I was here at the beginning of my tenure, so it's great to think about a recap here at 1 year. And I'm so proud of the team at CDC. Look, we've all been through a lot and learned a lot over the course of the COVID pandemic. And we are very much putting a lot of those lessons learned to work at the CDC. So whether it's making sure our data is turned into action more quickly, right? Whether that's for overdose data, or I hope you're checking out our new heat and health risk tool that folks can use. It's hot out there, stay cool. Or that we're giving simple guidance to folks. We've certainly simplified our guidance for things like flu and COVID and RSV. Top line is get vaccinated. That will save your life. I think that we are really building relationships in different ways. We know how hard it is to protect the health and improve lives of this country, which is the mission of CDC. We can't do that alone. And so I think we are partnering very deeply and differently, and that we're integrating with the health delivery system. So I'm really proud. So we've been doing a lot of hard work and continuing to be the response agency that the country needs. So I spend a lot of time these days thinking about avian flu in our dairy cattle. I'm sure we'll talk about that. And so I'm really proud of what we've been able to accomplish. We're really focused on three major things at CDC. We're focused on being ready to respond to any health threat. That could be a virus like avian flu. It could be the extreme heat, which we know impacts our health. It could be overdoses or suicides, where we lose hundreds of thousands of folks. So in order to be able to be that response agency for the country and to keep us safe, we need some core capabilities to be able to do that in a disease agnostic way. So whether, again, infectious disease or non-infectious disease, we need the data capability, we need the laboratory capacity, we need the talented, diverse workforce, and we need the response capability. It is a skill to be able to respond. And those are the things that we have really been prioritizing as a team at CDC. We've done great data, but often that data was siloed by disease. Right? Our HIV data was over here, our COVID data was over there, our malaria data, right? And so how do we think about bringing some of that together? Because we know we're all working with communities, with individuals who may be impacted by COVID and flu and malaria, and how do you think about bringing data together to identify concerning trends so we can respond, right? So we are really working hard as one team to bring together a lot of those pieces at CDC. So that's a big part of our work. We're also focused on improving mental health. Mental health, we know, was strained during an emergency, always is, whether that's a hurricane or a pandemic. And so we're seeing that play out in our data, more suicides, unfortunately, more overdoses, particularly as we're seeing more substances out in the market that are more potent. So we lost 100,000 people to overdose, 50,000 to suicide last year. We can do better. And I think CDC's role there is to really bring that data visibility. You can't solve problems you don't see. So we're really working on improving mental health. And then the last bucket is about CDC's work to support young families. And I want folks to know that CDC is out there working for them every day. I think folks got to know CDC in the pandemic. Sometimes that was for good, sometimes challenging. But the CDC is out there every day trying to make your family healthier. So whether that is making sure your kiddos get vaccinated, Or we were just sharing, what is the number one thing that is unfortunately taking the lives of our 2 to 5-year-olds, and it's drowning. So as we're here in summer and you're thinking about pools, right, there are things you can do to make sure you're protecting your kids, particularly our young ones, as we move into summer. So a lot of work around supporting young families. That's only the tip of the iceberg. And we do maternal, more, making sure mom is having a healthy pregnancy, that mom and dad are healthy and preventing diabetes, and stopping smoking again. So lifelong health. But I think overall, most importantly for this year, we've really been focused on that core mission: protect health and improve lives. And I've been traveling all over the country, helping folks get to re-engage with CDC in a new way. We're outside of the emergency, but how is CDC working for them in their lives every day?
Well, you're doing a lot. So one thing we talk a lot about here at the School of Nursing at Johns Hopkins is how to redesign healthcare and the healthcare system to deliver health and prevent disease. And so much of our healthcare system, as you know, focuses on sick care. And you've had an illustrious career at CMS and at Aledade and at the North Carolina State Department of Health, and now in your current role. And so you've been fighting this battle as well. And the audience may not know she was raised by a nurse. So you can hear her thinking holistically the way nurses do, that people aren't just their HIV or just their overdose. They're whole people who have, all the attributes of a whole person. But I wonder if you could talk about how the CDC is moving us from a reactive to a proactive approach in terms of health, and particularly how you're weaving health equity into that.
Sure. Well, first, a shout out to my mom, as you were mentioning, who is a nurse, who might be watching online today. Hi, Mom. But I think I actually have an undergrad student who's shadowing me today from Howard University, and we were just talking about this, about how often we train as physicians and we can be in a reactive posture. Someone comes to us, to our office, when something is wrong, right? They're not feeling well, or they have an illness, and then we try to react to that and fix it. And that is wonderful, and we need to keep that. So don't get me wrong, I spent many years training to do that. But I became very interested in thinking about how do we create a system that can prevent, that can think about the upstream causes of how did my patient end up here with diabetes, with chronic diseases, and what are the ways in which we could have prevented that. And so it is not a surprise, for example, that you hear in our priorities at CDC, that is, one of them is to support young families. When I think about, and the data tells us, what is it that shapes your lifelong health patterns, that actually happens in the first few years of life. So whether mom has a healthy pregnancy, you have that healthy first 5 years, you're having that brain development, you're having positive childhood experiences, you're getting your childhood vaccinations, that sets the pattern, both of also, are you getting nutritious and healthy foods, sets the pattern for your whole life. And we know from our data that your zip code determines your lifelong health patterns more than your genetic code. And so for me, as a young doctor, or frankly, even before I became a doctor, I was very interested in the system and how it does or doesn't work for certain groups of folks. Back to my mom again. My mom was an emergency room nurse practitioner. And I often recollect that the emergency room is the places where we see the broken parts of our system show up. Whether that's poverty or addiction, and that shows up in the emergency room, lack of access to care, and the inability to get to the treatment that someone might need. And so I saw that through her eyes. And so when I thought about my own career, I was really thinking about, what are the systems? I obviously spent a lot of time thinking about payment levers. What you pay for matters. That's why I went to CMS. Turns out we pay for a lot of care through CMS, and really important levers. And at the state of North Carolina, I wasn't just the health director. I was actually Secretary of Health and Human Services.
Yes.
And it allowed us to put together levers in public health with our Medicaid dollars, but with also our social service dollars, really to think about whole people and whole communities. And that's how we get to equity. So that you want everyone, no matter the zip code, to have the opportunity to be healthy. And I'm really proud of the work in North Carolina. If you haven't heard about it, please check it out. We had one of this first, I think, very innovative waivers in our Medicaid program to pay for things like food, housing, transportation through our Medicaid program. And it turns out when you pay for things that keep people healthy, you actually save money in the Medicaid program. And so we have an evaluation now to show that not only is it helping folks stay healthy, but it's saving money. And I think that that is what drives me. And I think CDC has a big role to play, bringing data and evidence and best practices to know what should we spend our money on.
Mhm.
What are those best practices, both to prevent drowning, but also to prevent COVID? And I think that's where we can be a really important part of the team in terms of building those healthy communities.
Great answer. We're
The
piloting
dean's giving me an A for something.
You're admitted.
Okay, great.
You passed. We're piloting a new program in Baltimore that's a coordination of Morgan State University, Coppin State University, University of Maryland, and Johns Hopkins, with the idea that everyone deserves a nurse and a community health worker, divided geographically so that kind of door to door in the laundromats and the libraries at the senior high rises, there's a nurse and a community health worker. And we started with listening to the communities about what people wanted. Now we're piloting it. We're starting with philanthropy, which has been very generous, but the idea would be that eventually insurers would pay for it because they would be saving that money and people would be healthier. We're really trying to turn primary care on its head. I think in primary care, we often see who comes to us, right? Like you said, if you don't feel well, you go. But what about the older adult who's homebound? What about someone who's homeless? What about someone who's too anxious to come or just isn't thinking about prevention necessarily? And the countries that have a more geographic approach like that, like Costa Rica, have much better health outcomes than we do. One of the things that Baltimore is a fantastic place, but recently it's been highlighted for having a higher rate of opioid overdoses than you would expect given its size. And we are finding that in our door-to-door work. And so we very quickly added fentanyl testing strips and Narcan, and we're really taking overdose prevention to the streets. But I know you talked a little bit about the opioid epidemic, but I wanted to give you a chance, since it's such a big priorities, to tell us about how CDC is tackling it and how you think programs like neighborhood nursing and other public health approaches can work with the CDC.
Great. Well, I think preventing overdoses is a perfect example of how protecting health and improving lives is that team sport. There's the role for CDC to play, but there are so many components, whether it's the health delivery system or the community, that needs to be part of that. From the CDC perspective, I think what we are investing in and that we bring to the table is first the data, right? Again, you can't solve problems you don't see. And what we've invested in is an overdose to data action platform that allows us and local communities, again, by say us, most of those dollars go right out to communities like Baltimore. They are one of the places where we fund, and where they're able to get real-time data on overdoses, but also what are those substances that are in the community that may be more potent, may be causing more harm to folks, so that folks can react quickly. And so data is important. The second is turning that data into evidence that allows us to also know, well, what works? What is it that works to prevent overdose? And some of the things you mentioned, like fentanyl test strips, Narcan, I'd also say connecting folks to recovery care in the emergency room. Again, these are best practices from CDC funded and evaluated projects where we know what works. And we also know there's a lot of opioid settlement dollars that localities and states are thinking about, how do we best spend it? I'd say look at the CDC evidence and data. We can be a partner there to help you think through what to spend dollars on, how to do that in a smart way. There are things you shouldn't spend your dollars on as well. So use that evidence. So that's where I think CDC can shine, our data and evidence. And certainly we're continuing to make investments to make sure we're evaluating what works for communities.
Great. I'd like to turn to gun violence for a minute. So one of the major focuses of the School of Nursing at Johns Hopkins is we have researchers who do a lot of work on intimate partner violence. And unfortunately, it's a large problem. And when someone has a gun, they're 5 times more likely to kill their partner in a intimate partner violence situation. And in fact, cool fact for us, last week when the Supreme Court decided the Rahimi decision, they cited data from a faculty member of ours in the decision. So just in case people think that research doesn't lead to action, it can. But so I know the CDC has a National Intimate Partner and Sexual Violence Survey, which is the leading survey on domestic violence that drives policy and recommendations. And I just wondered if you could talk about the CDC's approach for addressing gun violence and interpersonal violence in our communities.
Well, we know there are a lot of health threats out there, and I think very important that CDC is focused on obviously the infectious disease threats, but we know we are losing folks overdose, suicide, and and gun violence are linked. We know half of suicides are because of guns, and if you look in males, it's even higher. So thinking about, and this is where I think CDC data and evidence, where we talk about safe gun storage and other important interventions to make sure we're keeping people safe, and that we can make sure folks know there are resources in the moment of crisis for suicide is really important. I've been traveling around the country in the month of May. It was Mental Health Awareness Month, and I went to a number of our communities that are doing really good work in suicide prevention, and this is where things like 988, 24-hour, 7-day-a-week place. You can call if you are in crisis, 988. You can text as well. These are the kinds of combination of things. If we do the gun safety work, we do the suicide prevention work, we can absolutely save lives in every community across the country. But again, I think what CDC uniquely brings to this space is data and evidence, right? So again, we're helping us really understand what are the problems in this space and what are the potential solutions. I think that's what we're focused on, again, so we can identify those problems and map the right solutions.
Thank you. So let's turn back again to, you talked about young families earlier when you talked about the priorities, and we know that poor maternal health outcomes are a terrible problem in our country that really reflect structural flaws in the healthcare system and human services as you put them together. And CDC has the power to impact change at the systems level through data and surveillance, but also through development and dissemination of best practices, clinical resources, and tools. Can you talk about what you're doing at the CDC to improve maternal health outcomes and specifically the Black maternal health crisis in the US?
Sure. Well, I want to credit Secretary Becerra and Deputy Secretary Palm, who have made reducing maternal mortality a priority of the whole department. And CDC very much plays a large part of that. We are having too many moms die in the context of pregnancy, and that should not happen in a country as rich and innovative as we are. And so we particularly see, as you were saying, Black moms died almost 2.5 to 3 times more often than white and Hispanic moms. And so trying to understand and then map solutions to those problems. So again, that data comes from the CDC. CDC is now able to run maternal mortality work in all 50 states. That was something we were only able to do in a subset of states just a few years ago. So we've expanded that work. And what has come from it, again, data to action, is from those mortality reviews has come the information about needing access to care during pregnancy and after pregnancy. Particularly mental health care is really important. So one of the things that it has driven in many, many states is to make sure that Medicaid coverage was expanded for 12 months after delivery. So that, again, CDC data and that work has driven policy action at the state level, which I think has really improved care for many moms across the country. So those are really great outcomes, but we have more work to do. And so CDC, again, what do we do best? Get in the theme, right? Go back to our data and our evidence. And we recently put out an evidence-based packet around what to do in pregnancy related to hypertension. So we see a lot of, unfortunately, higher rates of hypertension in African American moms. And so there are real really important, simple ways that we can be thinking about hypertension during pregnancy in terms of getting blood pressure taken at home, making sure you're flagging that for your obstetrician, and make sure we're talking about it, right? Importantly. So there are lots of ways, whether it's connecting folks to mental health care, or thinking about hypertension in pregnancy, and then getting to some more of the root of systemic issues that are driving some of the differences. So those are the ways in which I think CDC, again, highlighting the data and evidence.
Thank you. So for my last question, and then we'll get to audience questions, I want to circle back to community health and primary care. So schools provide, this is from the CDC website, schools provide a direct touch point to 95% of our nation's young people. And, they go every day in general. And they're a critical setting for prevention. And I think some people even think that the future of pediatrics in general will be in the schools, and you'll go to a pediatrician office for something that's really specialized. But in general, where people are every day is where healthcare should be. I mentioned the neighborhood nursing. We're also, with Morgan State and Coppin State, providing nurses into the Baltimore City school system. Between the three of us, we're doing 15 schools so far. And so more than 3,000 children between kindergarten and 8th grade have a nurse in their schools because of this partnership. And that's going to grow in the fall. And I know, school health is an important part for the CDC as well. You've got CDC Healthy Schools. And I wonder if you could talk about how that program bridges the gap between primary care, and tell us something exciting about that program.
Sure. Well, you said a lot of it in your setup, which is, right, schools are such an important space for us to make sure we're thinking about health and well-being. Again, where are those lifelong patterns of health? They start when we're young. And importantly, though, like, teachers have a big job to do already in educating our students. And so the simple things that we can do to make sure that they're flagging things that might be of concern, and then to hand those off to folks with more training, expertise. Best when we can do that embedded in a school, right, to make it easy in terms of access. And so we have a lot, again, of opportunities to think about embedding best practices into schools. I'll go back to youth mental health. That is a big area of focus. We have a guide for schools on youth mental health. For any of the educators out there, I'd love for you to take a look at that. That's been something that we've been talking about for about 6 months now. Great simple tools that educators can infuse into the work they're doing. Again, trying not to add to an already busy day, but to give folks the skills that they need. Again, that was all driven from evidence and data collection that the CDC does, and map that to best practices that can be used in a school setting. But we also know that, when kids are together, lots of germs, are happening as well. So in school, we just actually released updated guidance about preventing illnesses in school. We know how important it is for our kids to be in school and learning, and wanting to make sure that we are doing everything we can to minimize the reasons kids may be out of school, and making sure we are helping folks know when to stay home if you're sick, and when, lots of kids have runny noses. It's okay, go to school, right? Be in school and be with your friends and learn. And so I think those are some really good, simple guidance for families, for schools, to keep our kids in school, and of course, keep our teachers healthy as well.
Great. So you talked about health being a team sport, and team, the larger HHS, as well as the team in terms of clinicians. And you've had such a fantastic overview of the healthcare system from all the different jobs that you've had. And before we close out, I just wonder if you could talk about, in your dream world, how we would better integrate healthcare, public health, and social services to achieve better health outcomes.
Well, thank you. I've had the opportunity at the state level in North Carolina to bring a lot of those threads together. I already highlighted that work, Healthy Opportunities. Go check it out. But as I think about this team sport of trying to protect health, there are some key things that I think we need to do. And if you're having trouble sleeping, you can pull up a New England Journal piece we wrote on this. It might put you to sleep. deep, but also outlines this framework. One is data, right? I'm a data gal, but data is the oxygen that powers our ability to see threats and respond to them, right? So if we can't see problems, you can't solve them. You need that data infrastructure. And people don't walk into health departments, they walk into doctors' offices, emergency rooms, schools. So how do we think about using that kind of, or frankly, they're online, they're on social media. How do we think about those kinds of inputs from a data perspective to help us identify threats early and respond? So the most important thing I think we need to do to create a world in which we are all on one team is with that combined data infrastructure. Then the second is that we all need to know what our role is. So the role in public health is a little bit different than the role in the delivery system, but we need to make sure, okay, this is what your role is, both in an emergency and in peacetime. And this is what you should expect from public health in terms of what we're able to bring to the table in terms of response. And so I think that role clarity is important. And then it's also about investing in things as a team. So I was just in Northwest Arkansas, for example, where they are struggling with maternal mortality, which we talked about. They're, I think, 46 out of 50 in the country. So they've come together as a community to say, how can we think about this as one team? Health delivery system, public health, education system, and government institutions. And you have to solve that problem as a team and really come together around aligned investment. So it can't be just investment from public health alone that's going to fix maternal mortality, right? Which is why I said, terrific job at the state level on using Medicaid dollars to also help solve those problems. So I really love communities coming together to say, like, look, this is the tough challenge. I heard it in Baltimore. You're seeing more overdoses, right? How do we solve this as a community, hold ourselves accountable, and kind of focus on one goal? Better or worse, during the pandemic, we all had that shared enemy, COVID, right? And so it was really unifying. And I saw a lot of folks come around the table and be partners in a way they've never done before. In North Carolina, I saw our hospital systems, normally competitors, come together in alignment in ways I've never seen. We had our private sector manufacturers said, how can I help, right? We had the Chamber of Commerce say, how can I? And academia. And so it was amazing. But what I'm seeing now is we don't have that common enemy. We kind of all go back to our silos and to our corners. But I'm hoping that we don't forget how important it is to try to solve problems together as one team when we have that focus. And it's not always going to be the same in every community. Baltimore, it might be opioids. Northern Arkansas, it might be maternal mortality. But have that conversation, have those people around the table, and then use the different levers. Sometimes they're data levers, sometimes there's payment levers, sometimes it's social media levers. And how do you use those together to solve problems for your community?
Great. So thank you very much. And some of those questions were woven in from questions people had submitted ahead of time. We now have a chance for questions from the audience. There's one mic stand there, and please line up so you're not blocking anyone's view. And while I'm waiting for the first question, here's one that was submitted when people registered, which is, how would AI assist in community and preventive health in the near future?
Sure. Well, I think you've heard over and over today from me about how important data is. And then, so what I think AI can offer us is the ability to look across what can be a noisy set of data, right? Does this matter? Are there patterns here, right? And to look across a complex set of data and say, what are the signals versus the noise that we need to pay attention to? For example, if you can imagine using language models to understand if we saw more school absences in a community all of a sudden, why would that be happening? Now, it's not a definitive signal, but I certainly, as a public health official, want to ask a lot more questions. What's going on in that community? How is there something we need to understand differently? Similarly, on social media, if you can imagine, everyone's Googling, "I have a headache," or "What should I take for my headache?" Those that could be a signal, but how do we think about what is noise and what is signal? I think AI has a lot of opportunities there. And I think also thinking about making sure, again, that we're making the investments to keep up with the AI investments I see made in other parts of healthcare. I want to make sure that we have those public health use cases as part of the conversation.
And you talk about trust a lot. And of course, there's a lot of people who are nervous about AI. So it seems like that'll have to go hand in hand with building the trust for AI and using it in trustworthy ways.
Absolutely. So I think the Biden administration's been really strong on this, and the executive orders that are there around making sure we have a really good guardrails and protection on privacy, right? Because unless you have good data inputs, you're not going to get the output that you need that can actually be useful. So I think we're approaching it with the right sense of humility, but I also think a lot of opportunity.
Mm-hmm. Okay. Please introduce yourself and ask your question.
Hi, so my name is Arjun Ryan. My background is in pharmacy. I wanted to say thank you, Dr. Cohen and Dean Szanton, for this wonderful event and the opportunity to ask these questions. So while the CDC does a really great job at generating data and translating that into evidence, an issue which I see in the uptake of evidence is stigma. So what is the CDC doing to address stigma and payer incentives as barriers to the use of evidence?
Well, that's a hard question. And again, one where I think CDC can help a bit. I think we do research in understanding stigma. One of the areas that comes to mind is obviously a lot of work around HIV for decades, where we're trying to understand the folks' barriers to accessing care in that space, both globally and here nationally. And there was a ton of work done on the CDC side to understand those stigmas, how to overcome those kinds of barriers. So one, I think we just generate good evidence around it. But this is where I think trust building overall is really critical and can't be done by CDC alone, and which is where I think public health needs to partner with trusted partners already, right? The way you build trust is to work with folks who already have trust in communities. I can talk about my experience in North Carolina, things we care about. We care about NASCAR, basketball, and we're a very faith-oriented state. And so trusted folks from the faith community. It's not surprising. I got my COVID vaccine with a civil rights faith leader, and also posed in photos with NASCAR drivers, right? So how do we think about using trusted messengers to destigmatize things like whether it's getting a vaccine, talking about suicide, or getting HIV care? I think those are all things that make some of these diseases more relatable, that folks talk about it more freely, and then go access the care that they need. So working with trusted messengers is really important.
Great. Thank you for your response.
Thank you.
Hello. Chris McRae, economistdiary.com. I've been to several events here which make this a very exciting time for data, because Johns Hopkins, as well as obviously the deep health roots, is in the middle of the Data Act. There was 10-year celebration of the Data Act. Mm-hmm. There was also a 2-day conference shared between the National Science Foundation and the engineered AI groups of Johns Hopkins. And basically, I was wondering, have you got some of your CDC projects connected with these groups of people? Because these are really deep learning projects, and it's a unique time for something like that to happen.
Thank you. I will go back and flag for the team. I don't know those specifically, but you've heard how important the data is and the oxygen. And while we're sitting just a few feet from the folks who give us resources, the importance of investing in our data infrastructure is so critical to protect this country. If we want to stay healthy, if we want to be economically prosperous, we have to see health threats We can't see health threats without that data infrastructure. Sometimes it can seem not very sexy and hard to understand, but that data is so critical. I was just on the Hill this morning talking about the importance of investing and continuing to invest in our data infrastructure. I think we're already bearing fruit from the investment we made during COVID in our data infrastructure. For example, right now, as we respond to the avian flu outbreak in our dairy cattle, we are able to see in real time de-identified, so it's right protecting privacy, but we are getting real-time data from 90% of the emergency rooms in the country. So we can look in Michigan to know, are there any unusual patterns of folks coming into the emergency room? And the answer is no, which is good, right? We can look for conjunctivitis, we can look for respiratory symptoms, and we also have laboratory data infrastructure in a way we never had before COVID. So we're able to take those investments from COVID, map them to the next emerging threat. So when I talk about the infrastructure that we need, that data, maybe today we're using it for avian, tomorrow we're using it for whatever the next health threat that comes our way. So data is so important, but we need the resources and the authorities to make sure that we can have that kind of visibility for the country, for our safety.
Thank you.
Hello, Patrick Wall. My question is, we're having a 2-day conference here on the prevention of childhood sexual assault. And it is, since 1 in 4 people, especially in the United States, are affected by this, and it's been a chronic long-term plague in society. What's the CDC vision for both the prevention of childhood sexual assault and also knowing that health outcomes are so affected by this large population being sexually assaulted as minors? What's the vision for helping those who've already been hurt?
Yeah, what an intense topic, and glad that Hopkins is shining a light on that. Our focus on supporting young families is in service of making sure we're identifying the ways in which we can make sure that we're supporting children and making sure they're both preventing adverse childhood experiences and being resilient through it. So I'm hoping that conversation both talks about the prevention, but also recognizing that some of our kids have been through some very, very adverse experiences, and how do we help them be resilient as they move through childhood and into adulthood. I think there's a lot of ways in which CDC data can help there, but that is a hard topic, and look forward to learning more about what you all are discovering and learning there.
Hi, I'm Shobha Mehta. I'm a maternal fetal medicine physician and a recent graduate with an MPH here at Hopkins. As you are aware, I'm sure, your predecessor commissioned a report, the McCrae report, that addressed some of the things the CDC could work on in light of the pandemic. And one of the areas that seemed to be emphasized was communication. I'm wondering if you could speak to your hopes and goals with relation to communication issues and the progress that you're making, both across levels, federal, state, local, as well as across sectors.
Sure. I think if data is the oxygen that powers our work, our ability to communicate is the effector arm, right? Is our action arm of that work. And so we have to be better. And I think we've learned a lot of lessons. I hope you're seeing us be different. One, go to cdc.gov. We have a completely new website. We archived 60% of what was on there because we wanted to focus on what was important and make it easier to navigate, and say there was stuff that folks didn't need on there in order to focus on the things that really did help folks be healthier in their own individual lives and in their communities. I hope you see a different kind of way of us presenting data. We've been working, for example, on an infrastructure on wastewater. So we're able to test things in wastewater and gives us signals about what's happening around the country. We used it for COVID. We used it for Mpox. We're now using it for avian. But not only are we doing the work, but we're trying to make it visually helpful for folks so they can see things in their neighborhood. neighborhood. So we have a whole new way of showing that data. We have a new heat and health risk tool. So you can go, it's color coded. And not only does it's not just about temperature, but it tells you what risks are, and it links you to guidance for you and what that heat might mean for you as an individual. But I think embedded in that question is helping us make sure we're meeting the moment of how people consume information today. And that is different from how they consumed information 5 years ago. And so not only do we need to be accurate and timely, we need to be engaging, right? Most of us, the way we consume our information now is in entertainment form. And so we're trying to think about ways to, of course, be accurate, of course, be grounded in the important data and evidence, but also meet folks where they are, whether that's whatever platform they're on. So follow me on Insta, or find ways to get in and cut through. So, we're trying to use Bridgerton themes or like Taylor Swift, right? So, to link to how folks are consuming information. I think we all have to be better storytellers. We have some incredible work across public health, but I think as many of you in the room know, when public health is working, it's invisible, right? When we do our job, you often don't see it because the success is in things not going wrong, and that's hard to get covered. And we have to be better storytellers about that work. I was at a conference last week and was joking about our malaria work that we did in Florida. For the first time in 20 years, we saw domestic cases of malaria. Work we do around the globe, CDC does that work to prevent malaria from coming here to the country. And good news is we've done that. No malaria has been here for 20 years, except for last year. But you didn't hear about Disney World being closed last year, did you? No, because public health worked. Right? Because public health, CDC and state of Florida did terrific work to extinguish that outbreak. And you're not hearing about ongoing cases of malaria, but we need to be better at telling the story of how we kept Disney World open, right? So those are the ways we're trying to be thoughtful about how we can tell those important stories and the investments we're making.
Hi, my name is Grayson, and I'm an undergrad student here at Hopkins. I would just like to say thank you, Director Cohen, for your impactful work in my home state of North Carolina and your service now.
Yay, North Carolina.
I'm wondering, could you speak more to the CDC's efforts to better connect with communities amid political polarization and rebuild public trust after the pandemic?
Sure. Well, one I want to start with, I think there's a lot of news about trust, rightly so. I'm very focused on making sure we maintain trust. And actually, there's been a couple of surveys recently about trust in CDC, and actually that's returned to pre-pandemic levels, so which is good. I think over the last year, we've been really working hard to show up, do the good work. I think that's how you build trust. You show up and you do good work, and we can show how what we're doing is impacting someone's lives and protecting their health every day. I think it's really important personally, and that's why I've been traveling around the country and showing up, right? You show up in person, have dialogue with folks, and build relationships. I also often talk about my own family. What do I do for my own family? And what are the recommendations I have for my 9-year-old and 12-year-old daughter? Because I'm not just recommending something abstract for the American people. It's what I would recommend for my parents, for my kids. I think that builds trust as well. And then, like I said, you just got to show up and do good work. And we're really focused on good execution and good operations. But that takes a partnership with making sure we have the resources to do it. It's why I spend as much time in DC as I do to help folks know that we're doing the work, but we need the resources to be able to deliver on what I think this country needs and to keep it protected.
That's great. Thank you.
Thank you.
Hello. Sorry. Okay. Hi, Dr. Cohen, and thank you, Dean Szanton, for having this session. My name is Sana Kataria. I'm a master's in public health student at Johns Hopkins. First of all, Dr. Cohen, I want to say thank you for the incredible work that you do at CDC in your data. From the heat risk sheets to releasing the interim COVID or influenza vaccine data, it's amazing. With CMS, they recently released that under the Affordable Care Act, they're going to be adding adult dental care as essential health benefits, but it is still up to the states on how they can do that. So I wanted to say how CDC is prioritizing oral health and how they're helping states with this. Thank you.
Great topic. One that, you know what, I'd have to get back to you on oral health, but I know an important part of the body and making sure that we're thinking about folks holistically. So I'd have to get back to you on the work that CDC is doing in dental health, but I know a lot. That was a topic I heard a lot about when I was in North Carolina and doing work. Particularly, I want to talk about young families and kids and making sure they have the dental access to care that they need and access to the fluoride treatments. And so a lot of ways to do it. Actually, this is another school-based linkage where in North Carolina, we have an opportunity to provide some of our dental care and fluoride work through our schools. So lots of linkages here. Again, a community approach to keeping our kids healthy.
That's wonderful.
Thank you, Dr. Cohen.
Yes, and yay, North Carolina.
Hello, I'm not from North Carolina, but
Hi.
hello anyway.
Hi.
My name is Cheryl Smith. I do a lot of work with senior citizens. Within the United States, we know that the senior citizen population is growing. The seniors are living longer. Can you please tell me how we are moving from inequities into equity and making sure they have the proper health care? Does CDC reflect the data that shows that things are getting better?
Yeah.
If you need me to help you, I'll be glad to do so.
Thank
Just
you.
let me know. Because with this population living longer, sometimes people are not prepared for it. I heard you talk about the young children. I heard you talk about the young families. Can you please tell me the data that you shared with us regarding CDCs and senior citizens in the United States and maybe even outside the country?
Sure.
Thank you.
Thank you. So obviously with going to COVID, we saw how COVID was something that was impacting our seniors more than other parts of the population. And we continue to have a very big focus as we'll move into the fall about flu shots, COVID shots, RSV shots for our seniors. There are ways we can absolutely save lives, keep people out of the hospital. We're going to have a communications campaign very much focused on our seniors come this fall to make sure they know about those vaccines, how it can save their lives, how it can keep them out of the hospital, prevent long COVID. It's so important for our seniors. So a lot of our work there is still a lot of prevention work to do for our senior population. And I was just talking with my colleagues at AARP last week about the importance of making sure we continue to stratify our data by age so we can do that targeted work. So you have my support and for our continued work to make sure that we're understanding different age populations so that we can make sure we're targeting our messages and prevention messages in particular. Thank you.
And if I can just add briefly onto that, one of the things with data with older adults is that we often just say 65 and above. When now people live to be 90, 100, you would never say 0 to 40 for kids, right?
Yeah.
But so that it's so important to understand, 65 to 75 is so different than 90 to 100, for example.
That's right.
Hi, Dr. Cohen. My name is Saliha Argui, and I'm I'm into health nutrition by interest. So, and I was just wondering what is the CDC doing to promote like more health care as opposed to sick care, like providing like low income communities with healthy food versus canned foods, as well as schools also. A lot of canned foods and processed food is offered, as opposed to fresh produce.
Sure. Well, I want to credit the Biden administration for really thinking about food as medicine in a holistic way across the government. I think we have a lot of levers to impact childhood nutrition, everything from childcare tax credits to our ability to offer free and reduced lunch at school, to then, again, on the healthcare side and the public health side, bringing the data and the evidence on why nutrition is so important for healthy development, but also school attainment and success. I think we're all starting to see those studies that show, particularly around kids who get SNAP, that towards the end of their month when SNAP benefits are running thinner, they do worse in school.
Right.
And then there's a rebound when the SNAP benefits get refilled. It's just remarkable. So we have to understand that educational attainment, economic attainment, and that food security, like it's all linked together, which again goes back to this theme of protecting health as a team sport. I think CDC, and again, we do work here in trying to highlight the data around nutrition, about school-based health indicators, but the implementation of what to do about it, it is a big table, no pun intended for food, of folks. And I really want to commend the Biden administration for recognizing that, bringing folks around the table to, there's, look, we have a lot of work to do in housing and transportation and intimate partner violence, but food feels very concrete that we can work on and solve and tackle in a short period of time if we're all pulling in the same direction. So very much appreciate that.
Thank you so much.
Thank you.
Thank you. Hi, Dr. Cohen.
Hi.
I'm Shannon Firth. I'm a reporter with MedPage Today. Thank
Hi.
you for being here.
Thanks.
And thank you to Johns Hopkins for hosting. I wanted to ask about H5N1. CDC just announced its research agenda yesterday. And one of the things that was mentioned was technical assistance for a program in Michigan that's looking at seroprevalence studies and asymptomatic spread, the possibility of asymptomatic spread. And I wanted to know if you could talk about that. And one other really quick question is just broadly, CDC, your focus is data. It's very challenging in some places to get data politically, and you're working with USDA, you're working with states who have their own feelings about how much to push, I guess, dairy farms. So maybe you could talk about some of the challenges in being a little bit hamstrung and getting the answers you need.
Well, it almost took us the end of the hour to get to avian. Usually that's my first question, but so let me step back, because clearly you are definitely following the work very closely, which is great. And I'll get to the question on the research. So overall with avian flu, I think everyone knows that we are seeing an outbreak in our dairy cattle, which we had not seen before. We've seen this in poultry for a number of years. We have a lot of biosecurity things that we do on poultry farms to make sure that we don't see avian spread further or to humans. And we are at the beginning of doing this work in the dairy space. Again, experience in poultry, trying to then map what we've learned there to the dairy space, work closely with USDA on this. What I would say overall, continue to see the overall risk to the population for avian right now to be low. But we've all learned through COVID that these viruses like to change. And that is the thing that we want to prevent. We want to reduce the likelihood that this virus changes and becomes more transmissible or more contagious. Right now, we have not seen a case of human to human spread of the virus, but we have seen from cattle to a farm worker. So we know contact can spread the disease. So the folks who are at most risk are folks who are in contact with poultry or dairy cattle. And so making sure we're protecting those workers, and also please don't drink raw milk. That's our focus. And so we want to understand, for those who are in contact with cows, are they being exposed and maybe not having symptoms? And the way we can understand that is obviously to do some additional study. We're in the middle of that, or frankly, at the early part of that study right now. So it'll be a bit until we have the full data, but we want to answer questions again, so we are smarter about how this virus moves, and doing everything we can to protect, again, human health, and cut down the likelihood that this virus can change. So we do want to reduce that likelihood. And on getting data, this is where I think we've made a lot of strides. I was mentioning the emergency room data, the laboratory data, the wastewater data that we're able to get. That is something before the pandemic, that did not exist, that infrastructure. So that investment is paying dividends right now for the United States. But Do we always want additional data? That's why we're doing this study in Michigan. And we want to make sure folks are monitoring farm workers, particularly their own health. And if they have any symptoms, making sure that they are going to get testing. So we continue to work with farm advocacy groups and others to get that message out. And again, this is something we've done in the poultry space for a long time. I think this is just a new space for our dairy farmers and want to make sure that we're giving them the opportunity to ask questions, learn as we go forward here. But I'm seeing, improving collaboration so that we're able to learn more and more each day.
Thank you.
We've got time for 2 other quick questions, and then we'll wrap up.
Hi, my name is Taylor Church. I'm an MD PhD student at Hopkins. I previously have done research in maternal mental health, particularly in the perinatal and postpartum period. And one thing that frequently came up was lack of access in rural communities, where mothers would be 100 miles away from the nearest psychiatric provider. What strategies are being used to mitigate this problem, whether it's telemedicine or increasing primary care education, et cetera?
Well, we saw during COVID, there were a number of waivers because of the emergency where we were able to use telemedicine in different ways. And I think we learned a lot during that. And I think there are ways in which we want to make sure that in-person is still really important for a therapeutic relationship, but there are a lot of ways in which telemedicine can help folks in our rural communities. So I think continuing to think about investments from a telehealth perspective, from a CDC place, I think this is where our data and evidence to just even understand who has access to what, where are the gaps, I think is our contribution to the dialogue here. And so continue to follow our work as we go forward. Thank you.
Thank you.
Great. Final question.
Hi, my name is Soraya Simon. I'm a private practice pediatrician in Northern Virginia. Thank you, Dr. Cohen, so much for the information that you've given us. One of the question I wanted to focus on, or the topic I wanted to focus on, is vaccine hesitancy. Vaccines are, as you highlighted, numerous occasions that it's very important in primary care and prevention of many infectious diseases, particularly HPV vaccine. I get a lot of hesitancy in the office, mainly because this is not a mandatory vaccine. Right now it is recommended. Because it's recommended, although the data is very convincing for prevention of cervical cancer, it is not as convincing enough for parents, although there's a lot of information, parent-friendly information. What is your advice on what could really give parents reassurance that this vaccine, although it's not close to home, because a lot of the questions that I get in the office is, well, it wasn't around when I was growing up, so why is it so necessary now? I do see that it prevents cervical cancer, but the chances, it's okay. I would rather, since it's not mandatory. So if you can speak on that, thank you so much.
Sure. So one, I just wanted to start with some of our routine childhood vaccines and just continue to commend the great work that our pediatricians and family physicians do in getting our kiddos vaccinated, because we have 93%, 94% of kids are vaccinated for those routine things, measles, polio. So we continue to do a very good job even post-pandemic. And so that is great. Then there are newer vaccines that I think we need to be focused on. And we also need to be focused on the annual vaccine, so COVID and flu. The best thing that I can offer is what I do, again, for my own family. I have 2 daughters who are 9 and 12. My daughter already got her first HPV vaccine, right? So I wouldn't recommend something that I didn't feel good about for anyone else that I wouldn't do for my own daughter, which I have done. We need to remember how hard we worked to treat and fight cancer. We have something that can prevent cancer, right? We have to use the tools that are available to us to protect our individual health, our family's health. And we continue to do incredible work to make sure that we are looking out for safety concerns. And again, I am the one who sees that data and was the one who said, yep, this is right for my daughter. And I hope folks can hear that. There's nice packets and flyers, but I think that's powerful to share those individual stories about what we do for our own family. I think that will help build trust. But a great place to end. What a lovely
Yes.
conversation. Thank you so much, Dean.
Thank you. I want to thank you, Director Cohen, for taking the time with us, and thank you for your leadership, and congratulations on a year in office in this role. And we're so excited to see what you'll do next.
Thank you. Thanks, everybody.